So welcome, everyone. I know there's a lot of good conversation happening in the hallways, but we did want to have a chance to really talk about the importance of health to SPARCC. I've introduced myself already, so I won't spend much time doing that. My name is Melissa Jones. I'm with the Bay Area Regional Health and Equities Initiative. That's our full name, but people only recognize it as BARHII. And we are the coalition of the public health departments. We care a lot about health equity, social determinants of health, and really seeing change for communities in health and wealth and all of the things that make our lives great and our regions great. And I'm joined today with a really powerful panel of people. Nancy Andrews from the Low-Income Investment Fund, Don Swartz from Robert Wood Johnson Foundation, Marion Standish from the California Endowment, John Williams, the Federal Reserve Bank of San Francisco. And they all have a vision and a frame about the importance of health and its connection to community development. And our goal is to talk about the cutting edge of that work today. We want to talk a bit about why health is so important to SPARCC and to each funder partner that's up here on the stage, about where we aspirationally want to be with health, because we've been talking about health and community development. What is the next phase and next stage of that work now? And what are the challenges we'll need to overcome to meet our collective vision? And so with that, I'm going to do the swap.
And John, I think we'll start with you. And I want to give you an opportunity to make some opening remarks about the connection between health and wealth and community development.
Great, and it's great to be here. It's great to see SPARCC taking off now after all the work that's been going on the last couple years around this. So it's a very exciting day for us at the San Francisco Fed. So you might ask yourself, well, why is the San Francisco Fed, Federal Reserve Bank of San Francisco, actually involved in SPARCC in the first place? So what is our role in this? And I would turn that question around a bit and kind of ask it this way. Well, why is an organization like the Federal Reserve Bank of San Francisco, which cares deeply, very involved in our economic future, how could we step aside on an initiative that's dealing with such important issues like SPARCC is? So that's why we're involved. I think I go back to a basic idea that prosperity is like a Jenga tower. You remember the toy with the blocks of the tower? So with a Jenga tower, each piece matters for the stability of the entire tower. And on the flip side, if you take out one piece, you put the tower's stability at risk, and of course, if you take too many pieces out, the tower can fall. I think the same applies for economic well-being. Economic well-being, as we've heard already this morning, it depends critically on a host of factors, not one or two, but many, that all together make for a healthy, strong, vibrant, resilient community. For our economy to reach its economic potential, it means that we need to address all of these together, not piecemeal, but together in a whole. That means economic mobility, health, jobs, education, and many others. And that's what we see as a key factor in SPARCC, and also we already saw in some of the presentations today. It's also what we see in the work of all the panelists that are joining me in their work, bringing together all these different aspects in terms of thinking about healthy communities. And obviously, we all thank the Robert Wood Johnson Foundation for their work in bringing people together and supporting this under their Culture of Health initiative. We all live in a world where our ability to reach our maximum economic potential really depends on our neighbors reaching theirs as well. We all do better when everyone thrives. And thinking about that, economists, I'm an economist, so I tend to think about things that we can measure, things I can put in our models and analyze. But, in preparing for today's event, I was reminded of something that Robert Kennedy said, and I'm going to read this because these are his words, and I don't want to mess these up. The gross national product does not allow for the health of our children, the quality of their education, or the joy of their play. It does not include the beauty of our poetry or the intelligence of our public debate. It measures neither our wit nor our courage, neither our wisdom nor our learning, neither our compassion nor our devotion to our country. It measures everything, in short, except that which makes life worthwhile. And he concluded, and it can tell us everything about America except why we are proud that we are Americans. So I talked to a bunch of economists yesterday at an event in New York, economic forecasters, and the topic of the conversation was really about how do we get this economy growing faster, gaining greater prosperity in the context of what I often call a Goldilocks economy, and that's one that's not running too hot and not too cold, one that continues to provide jobs, but it doesn't risk another crisis or a recession. And one of the points I made to that group was that this will require significant investments in our communities. And although it's not the purview of monetary policy, part of my job, that can solve that problem, each of us can do things, take our own steps in our own ways. And in that context, I think of an ancient proverb that says, while none of us are obligated to complete the work of repairing the world, this does not give any of us license to step aside and cease from trying. And so at the San Francisco Fed, we take that advice proverb very seriously. It means, although that we are not allowed by law to make direct investments into these areas that we're talking about today, we do view our mission and our values absolutely obligate us to do our best to bring stakeholders together to achieve the future that we aspire to for our communities. Now, at the San Francisco Fed, we've set a very serious goal to create a more diverse and inclusive culture and workforce at the Fed. And that means we've done this for two reasons. One is it's the right thing to do from a moral standpoint. It's also the right thing to do from a business standpoint in order to make sure that we're attracting the widest net of talent, the best ideas, the best perspectives, the greatest experiences will help us do our jobs better. And I think that applies exactly equally to thinking about our communities and how do we make stronger, healthier communities that enrich all of our lives. You know, when you think about the U.S. economy as a whole, anytime that if you hold any part of the economy back, you're actually holding all of us back. And there was reference already to the research on this, which is just overwhelming. We know that if you provide more income to families, their kids do better on math and reading tests, their scores go up. We know that if you can get people better housing, their lifetime, families better housing when they're children, the lifetime incomes go up by hundreds of thousands of dollars total. We also know that, as was already mentioned, that when you grow up in poverty in places like New York or other cities, that can shorten your lifespan by up to 7 years. So again, there's a moral imperative that we tackle these issues, but there's also an economic one. This is for our country to really gain its economic prosperity. We need to change these equations. That's why the San Francisco Fed is proud to be a founding member of SPARCC, proud to have been very involved from the beginning, and also very actively engaged in the search for answers to the very difficult issues that we've been talking about already today and we'll talk about for the next, or work on for the next several years. Questions about how do we find ways to invest in our communities. It means that prosperity can be shared by all, regardless of your race or your zip code. That we can tackle income inequality and economic mobility problems that have gotten so bad in just the last few decades. Obviously, that we can find ways to take advantage of the diversity of our society and our culture that makes us so strong as a country. And I'm really excited that we're able to be part of this today and for the next several years. Thank you.
Thank you. I think we'll follow that with some opening remarks from Nancy Andrews from the Low-Income Investment Fund, talking a bit about how community and health have been working side by side.
Sure, happy to do that, and it's just wonderful. As John said, it's just terrific to be here. Hats off to my colleagues and friends and all of the people that have worked for the last 4 years, I think, trying to put this together. And this has truly, truly been a collaborative effort, not just by organizations that are practitioners, but by the organizations that are also the investors and the champions and the cheerleaders. It's just been an extraordinary effort, and I hope that this moment where we're sort of trotting out and showing the wonderful examples, the videos, the discussions that we're having really can be a stimulus to all of us for what is possible. I also want to just to thank the Federal Reserve in San Francisco for having been such a strong voice in supporting us over the years in thinking about the new chapters and the new way of thinking about community development. And the Robert Wood Johnson Foundation, who both, not just with money, but with friendship and with encouragement, have really encouraged those of us in community development to recognize the importance of what we're doing to the goals of health, to the goals of creating a culture of health. Risa alluded to a book that the Low Income Investment Fund published with the San Francisco Federal Reserve about 5 years ago. The book was called Investing in What Works for America's Communities. And the hypothesis at that moment in time, the hypothesis behind that book was that place by itself, investing just in place, investing just in housing or the built environment, that by itself wasn't enough, that we also had to add human capital, we had to add people in a very affirmative way into that question. And frankly, that led us, as we began to think about how do we not just invest in buildings, but how do we invest in the people that live in the buildings, that led us to open up our eyes and to hear a message that was coming to us from Robert Wood Johnson, was coming to us from our good friends at the Fed, David Erickson, who actually at one point did a brilliant thing of putting a heat map. Everybody knows what a heat map is, right? It's red is bad, blue is good. So David put up a heat map of almost any city that you go into in the United States. If you put up a heat map that shows where the concentrated problems with health are, and next door to that, you put up a heat map that shows where the concentrated problems of poverty are, and then you bring those two maps over on top of each other, you discover they are almost the identical same map. And what that did for me personally, it's a very personal story, was if a light bulb went off, and I suddenly began to understand that the places where we as community developer practitioners had been working for 30, 40 years were exactly the same places that our health colleagues had been working for many, many years. And when the lights went up and on, I suddenly realized that there were colleagues that I didn't know, there were friends that I hadn't yet made, and there was much, much work that we could do together. So that has been, I think, a super important chapter and recognition and understanding of what we can be in the future. SPARCC is central to that, and I think the third leg on the stool that we're beginning to put together is the insight that comes from realizing that if justice and fairness is not at the center of our agenda, then everything else that we're doing really doesn't matter. We can build all the housing that we want to build, we can invest in all the schools that we want to invest in, or in all the health services that we want to invest in, but if the people that live in those communities wake up every morning and they feel like the scales of society are really tilted against them, and they carry that feeling 24 hours a day, it really doesn't matter how many investments we make. So we need to integrate those things, all of those things together into a broader vision. I think that's what SPARCC is doing, it's beginning to do. I think of it as the next chapter in our work in American social progress, and I couldn't be more happy than to be here with you all today. Thank you.
Great, thank you. And now Marion Standish from the California Endowment, which of course is a huge influence on us in the Bay Area.
And ironically, we're all three of us, at least four of us, from the Bay Area. So salutes to our California colleagues out there. And congratulations to all of the 6 SPARCC communities, regions. It's really a very exciting opportunity that's in front of us. And I think many of us on the health side have been working to try to bring our various and diverse sectors together, from health to community development to the environment. And While those of you on the practitioner side have your own challenges, rest assured philanthropy has very, very similar challenges in trying to align and collaborate. But because of the leadership of our respective organizations, and I just want to call out Risa's leadership here from the Robert Wood Johnson Foundation, I think we've gone a tremendously long way in achieving that kind of collaboration at the philanthropic level. So our initiatives are far more aligned, and I think will have greater impact over the long run. It wasn't easy, but I think it's a new day. And I think SPARCC is a great example of that new day. I just want to make a couple of remarks coming out of the California Endowment's very deep place-based work in 14 communities in our state. This is a 10-year, $1 billion commitment that the foundation has made. These are 14 places that are not necessarily cities. Many of them are neighborhoods. South Los Angeles, for example, is one of our places, and while it's bigger than most cities, many cities, it in and of itself is not a city. And that effort was linked very intentionally to a state-level policy capacity and a very robust communications effort. And I want to speak for a moment coming out of our lessons learned. Anyway, coming out of our lessons learned. And I think what we've seen over the last 6 years is that change is happening. And I think we are very optimistic and enthusiastic, very hopeful about what this type of effort can produce, not just in terms of individual interventions and opportunities and outcomes, but real transformation. And I think that's what SPARCC is about, and I think that's why these lessons are so important. We've seen change in California in the healthcare arena, where the state has probably among the strongest and most effective implementations of the Affordable Care Act in the country. And we've seen reductions, dramatic reductions in the uninsured rates, especially among Black and Latino adults, adult men, who typically don't participate in the healthcare system. We've effectively brought in undocumented children into our healthcare system. And I'm going to get to the why this matters in terms of lessons learned. We've seen changes in school climate. We've seen changes in the youth justice system, and we've seen significant changes in land use. But what are the key lessons that we've derived from these accomplishments? And while there are many, I just want to highlight a couple of them. The first is that our effort is really not simply about geography. It's not simply about your zip code, even though we know that's been a good marker for us, and it's a good way for us to talk about our work. But the power of place is really about the fact that it is where inequity, it's where injustice, it's where disparity, inequality really all come together, and they all show up. Whether it is about healthcare, whether it is about transit, whether it is about climate, whether it is about any housing, of course, any of the issues that we're talking about, place is where all of that shows up so powerfully. But for us, where it really came into play was in the dramatic impact that those injustices had on the actual experiences of real people. The pain, the trauma, the community-wide feeling of being left out. And you feel that, for example, if you're in a city like San Jose, California, where Silicon Valley and the wealthiest people in the world are making money, and you can't even keep a health clinic open or can't find a grocery store. So that experience at the place level is really palpable. And it is very real. And those of you who are working at that level understand what I'm talking about. So it challenges all of our assumptions. And I know all of us have spent the last few years designing and developing this beautiful initiative called SPARCC. And I think it has every one of the ingredients for success. But it will challenge as we move into community. And if we're serious about engaging community, it will challenge all of our assumptions. And the ultimate lesson for us is to be less focused on what our outcome was, even though all of us want an outcome. And certainly those of us in the health world know 3 years isn't going to get us much of a health outcome. But that engaging community is really about building power and enabling and facilitating the true, and I mean true, voice of community, because it could take us down some paths that we don't anticipate. And we need to be open to that as we move forward, because ultimately we will see transformation as a result. And that's what health is really all about, and that's what our success will be all about. So that's our health connection.
Thank you. And power is a big health connection. We'll go now to Dawn, who, as a pediatrician and a philanthropist, how do you like that? Has a lot to say, I think, about the connection between health and community development.
Thanks, Melissa. I am going to start with an assumption that people who are here get the connection. You've heard about it this morning, but I think you probably came into the room with some general orientation toward the value proposition of health and community development and climate working together. But I want to shift the conversation. And I want you to begin by thinking about a requirement for poor folks in parts of the country. Imagine if we required that everyone had to own a car, and we didn't subsidize gasoline, and everybody had a car, and some could drive it and others couldn't. But because everybody had a car, there was an assumption that people could get to work. We'd call that really inequitable. And there would be a lot of discussion about who was responsible for people having access to gasoline. And some folks would say the people who are responsible for gasoline are all those people in the auto industry who are profiting from sale of automobiles, but not subsidizing gasoline. It's not exactly an externality argument, but it is an interesting argument about equity and who owns equity. I'm a pediatrician. And throughout my practice life, I saw a lot of children, also from Philadelphia, where Risa is from, who came from the kinds of neighborhoods like the neighborhood around the North Philadelphia train station. Early in my career, I was visited by a relatively young but terribly old-looking grandmother with a tiny baby in her arms. This infant had been in an intensive care unit for the first 90-plus days of life. And during that time, incredible technology that has taken us more than a half century to develop was deployed to keep this infant alive. And at the time of discharge, surprisingly, this infant was remarkably intact. She had been born at about 6 months gestation, and at that time in this country, that was particularly testy in terms of the ability of technology to create an intact child 3 months later. And this grandmother walked in with this baby who was blue and cold and still alive, but very much undernourished. We had spent $1.5 million assuring that that 6-month infant made it out of the hospital. And we discharged that infant to a home that was infested, that was mold encrusted, that was stormwater vulnerable, that had intermittent electricity despite all the devices that were needed to keep this child healthy, and had neither access to heat or air conditioning. Are hospitals like the automobile industry? The hospital made a 4% profit margin on that infant. 4% is good for the auto industry, for the sale of a vehicle. We don't think of responsibility within the healthcare industry, responsibility within the healthcare industry for what happens after discharge. But maybe there's a responsibility, because people need healthcare, as would poor people need gasoline if we required people to have cars and work. We have a set of assumptions about healthcare that SPARCC has an opportunity to change, not by creating new responsibilities, but by creating new partnerships. The Robert Wood Johnson Foundation insisted that SPARCC engage the healthcare sector in the 6 regions where we're deploying SPARCC. And everybody looked at us like we were crazy, because around the country, as we look at places where community development is thriving, over and over and over again, those in community development have tried to engage the healthcare sector and failed. The healthcare sector and the community development sector, as Risa said, one day, we believe, will be the same. But we're not going to get there without healthcare feeling a responsibility for community development, and community development understanding that vulnerable people who the healthcare sector creates, cares about, and maintains those people will never survive unless we build communities differently. That's what SPARCC's about. But SPARCC is not going to get to where we all need to get to from 6 regions. So the model of SPARCC says, not only do we have a learning community, but we have a vision that all of the partners and all of you are going to be able to work together to learn from SPARCC and take what we learn to build a value proposition that is strong enough and powerful enough that we transform both community development and health and climate to say we have one important value proposition around equity. And these are all pieces that have to work together in order for that value proposition to come true. So you are all deputized by SPARCC. Once you walked in the door, you had your cup of coffee, you had your whatever you ate that may not have been so healthy, but I'm forgiving everyone. Once you did that, you were deputized. Deputized to try to think about and learn from 6 places around the country that are going to try to deal with an incredibly complex set of issues with theories of change that could boggle the mind. But each of us has a responsibility to extract from that a piece that we articulate in a cogent way, and we use that to try to change the understandings and realities of each of our sectors. If we begin to do that, then there'll be people up here who aren't just from the Bay Area, but we'll have people from all around the country. But in addition, we will have changed the opportunity for a 35-year-old grandmother who's raising a very vulnerable infant to be able to do that in a way that we all feel comfortable will guarantee an incredibly healthy life for that baby.
Thank you. I want to move from there to questions or comments from the audience. Do people have cards or paper where they've written questions down? I see a bunch. as we're collecting those questions, I'll pose another, which is that the SPARCC cohorts have just spent several days together talking about our projects, all of us having pretty significant public investments coming into our neighborhoods and regions, and also are looking at the SPARCC resources and other resources and trying to think about the capital side of investment that relates to health. Are there lessons or models and ways that you've seen that used that you'd like to share?
Capital? Is that something that we do?
Yes.
Yes. I mean, I think that, number one, a little bit of humility. This is a somewhat new area for those of us in community development, so we're finding our way. There's a lot of testing and trying, and with that, a little bit of failing that's going on. But some of the things I like to talk about, a couple of stories. One, I see Judy Kendi, I saw in the room somewhere, that when Judy worked with LIF, she was instrumental in putting together a project in New Orleans that was in an area called the Mid-City neighborhood. This is a community that is about 50% poor, poverty rate of about 50%. But this project had a soaring vision behind it. It was a multidimensional effort on the part of the city of New Orleans, on the part of a neighborhood developer to redevelop housing, and on the part of a collaboration called Refresh that was bringing healthy food into the community with a small footprint Whole Foods store, job training for young people in the community through something called Liberty's Kitchen, a collaboration with Tulane University Medical Center to teach doctors and residents how to prepare good nutrition and how to prepare healthy foods and how to interact in a way that was actually training docs to work with the client population. And also, on top of that, a school management organization. So multiple threads being brought together in a single place. It also engaged the private sector, philanthropy, and the city. And what was going on was that people were a little bit stuck at the closing table. They had all of the pieces, but as they came together, they discovered that each partner had differences too, and they had to figure out how to work through those differences in a way that would make this investment come together. The role of an organization like the Low-Income Investment Fund or Enterprise or our many partners in community development finance across the country is often a little bit of a Yenta role. We're trying to do kind of a matchmaking of capital. And so when you have partners that each have different requirements and can't quite find their way to bridge to one another, sometimes what we do is we try to create what I call the glue capital. It's the capital that kind of smooths off the rough edges of each other's requirements. And so we did that at LIF. We did that using our healthy food financing funds. And what we did is what I call, we went to the bottom of the dog pile. We were very happy. We saw all these partners that couldn't get along, and so we said, we're just going to subordinate to all of you if you'll just come together. So we went to the bottom of the dog pile, and when we were willing to do that, little by little, each partner gave enough that they could make each other come to the table, and we had that deal done within a year. So I think that's a great example of how it's possible to use private capital, but also you need creative capital alongside it to try to bring the pieces together and make these very visionary projects come to life and have a future.
I was going to add patient capital.
And patient, it was
Yes.
20-year capital, by the way.
So one of the questions from the audience is about the time period of SPARCC. And 3 years go by fast. And we have an initiative in the room that's ending their first round of a similar initiative. How do you think now about how to sustain the work beyond the 3-year period?
Well, I'll just jump in. I think, as I understand it, forging these relationships is really what will sustain the work. It can't, I mean, the resources matter, and presumably there will be more resources down the road, but I think the relationships are the critical piece that will really hold these efforts together. None of these organizations are leaving these communities, and they're going to learn to work with new partners in very powerful ways, and that will, I think, inspire continued collaboration.
Can I jump in on that a little bit too, and just say that I have absolutely every confidence in the folks that are in the room in making this stuff work. And I think that as we give it life and oxygen and breath, we will get positive stories that will come out of that will be compelling. We'll probably also get a few things that don't work so well. And that's great, that's fine, because part of this process is creating a learning community, a learning opportunity. Mm-hmm. And so giving it a little bit of life, I think, means that 3 years from now, we will have very compelling information and very compelling progress that I am confident we will continue to earn the confidence of the funders and attract them in. And remember, there are trillions of dollars that are at stake here. There is money that's going to be going into these communities. If we spend that money in what I call business as usual, we're going to find ourselves with growing segregation, with people being pushed out and left behind. So frankly, we don't have a choice. We have to figure out how to invest in ways that reverse that dynamic. And I think that's what SPARCC's all about, and I am completely confident that it will continue beyond.
Okay. And we have a number of questions that relate in different ways to the Affordable Care Act, so I'm going to close with these questions. And there's a few. One is, have you considered supporting research or advocacy on the Affordable Care Act mandates for community needs assessment and community benefit centers, or community benefits dollars by hospitals? Another is about the question of the recent repeal that has failed, and if there is a view or a support for single payer, and feeling that there's a moment for that now. Another. Why don't we take those two? The others are versions of those kinds of questions.
So I think we know about as much in terms of what the Affordable Care Act will look like in a year as we know about everything else. And as a result, I am not going to comment on single payer, but everyone can talk to your neighbor about that, because I think your neighbor will know as much as I do about whether we will have a single payer system sooner or later because of what's happening today, tomorrow, and next week regarding the Affordable Care Act. But I don't mean in any way to minimize the importance of that question. What I will say about community benefit is that remember that the penalties at the moment for hospitals that don't do what's required of them around community benefit are really pretty small and meager. And when the standards for community benefit were put forward, I think the expectation was that this might nudge hospitals, but it wasn't meant to be as big a hammer. What was a bigger hammer was changes in reimbursement patterns. So people who have to come back to hospitals within 30 days after discharge, the hospital doesn't get reimbursed. So a lot of folks are focused on community benefit from the outside, because that's an opportunity for folks on the outside to get into hospitals for conversations. And it's an opportunity for hospitals to learn about and begin to think about what they can do as partners with communities. I don't believe that's going to change. I think that the value proposition for hospitals, as we talk to hospitals and health systems across the country, has been made. The question of how much they can invest in change is an open one that's going to depend a lot on reimbursement and any change that happens with the Affordable Care Act. But the value proposition for partnerships and understanding and beginning to step outside the walls of hospitals to do things with communities in order to improve the health of the people who they care for, I think is there. It's been made. It's going to go forward. So I'm very optimistic about that. I don't want to say anything about single payer or the ACA, but I do think community benefit is part of our culture.
Just to add to Don's point here, I think, and Darren said this earlier, that SPARCC creates a platform for collaboration. And in the healthcare arena, which has been sort of walled off in many ways from community, having a platform, having a vehicle that would enable their participation in broader community activity, I think is essential. Without that, then they are using their community benefit resources for little fragmented activities that are good but don't really amount to the type of transformation that we're after. So I think the creation of the SPARCC platform is a tremendous innovation and opportunity to bring the healthcare sector to the table in some very meaningful and resourced ways.
Well, good. Let's thank our panelists.